Your new knee is an investment in your future mobility, but even small missteps during recovery can set you back weeks or even months. Too many patients accidentally sabotage their own progress with well-meaning but misguided decisions. Here are the 5 biggest mistakes that could be standing between you and getting back to the activities you love. First, ignoring prescribed physical therapy exercises. Your window for optimal range of motion is narrow. Those first 6 to 8 weeks are absolutely critical. Skipping therapy allows scar tissue to form and muscles to tighten. Second, failing to manage pain with recommended medications. When you skip pain meds or try to tough it out too early, you're actually setting yourself up for a longer, more difficult healing process. Uncontrolled pain makes you avoid the movement your new knee desperately needs. Third, avoiding early knee movement and flexion. Staying still is your enemy right now. Think of your new knee like clay that's slowly hardening. You want to shape it into the right position while you still can. Fourth, putting full weight on the knee too soon can strain the implant and slow recovery. Finally, neglecting follow-up appointments with your surgeon can lead to undetected complications. Remember, consistency beats intensity every time. Trust the process and follow your recovery team's guidance.